everyone, I'm Jinsu. Happy to see you again. In this session, I will explain the planning phase of the nursing process. By the end of this session, you will be able to state the criteria of setting priorities, describe the components of goals and desired outcomes, and describe the types of nursing interventions. Let's review the case we discussed in previous sessions. In the end of last session, I had a question for you. Have you determined the nursing diagnosis for Mrs. Lin? Yes, the nursing diagnosis for Mrs. Lin can be impaired gas exchange related to altered delivery of inspired oxygen, anxiety related to perceived threat of death, and deficient knowledge related to lack of information and resources. Now, let's learn how to plan nursing interventions for her accordingly. The process of planning includes setting priorities, establishing patient goals or desired outcomes, selecting nursing interventions and activities, writing individualized nursing interventions in care plan. First, the nurse and patient decide together that which nursing diagnosis requires attention first, which is second, and so on. Nurses can group them as having high, medium, or low priority. Life-threatening problems such as impaired respiratory or cardiac function are assigned as high priority. Health-threatening problems such as acute illness and decreased coping ability are assigned medium priority because they may result in delayed development or cause destructive physical or emotional changes. A low priority problem is one that arises from normal developmental needs or that requires only minimal nursing support. Nursing diagnoses such as ineffective airway clearance and impaired gas exchange would take priority over nursing diagnoses such as anxiety or deficient knowledge. Now, can you set the priority for Mrs. Lin? It's not necessary to resolve all high priority diagnoses before addressing others. The nurse may partially address a high priority diagnosis and then deal with a diagnosis of lesser priority. Furthermore, because the patient may have several problems, the nurse often deals with more than one diagnosis at a time. After establishing priorities, the nurse and the patient set goals for each nursing diagnosis. In a care plan, the goals or desired outcomes are the observable patient responses, what the nurse hopes to achieve by implementing the nursing interventions. Goals and expected outcomes must be measurable and patient-centered, focusing on problem prevention, resolution, and rehabilitation. Now, let's get to know the short-term goals and long-term goals. In an acute care setting, most goals are short-term since much of the nurse's time is spent on the patient's immediate needs. Short-term goals is a statement distinguishing a shift in behavior that can be completed immediately, usually within a few hours or days. For example, patient will have lungs clear to auscultating during entire post-operative period. Long-term goals are often used for patients who have chronic health problems or who live at home, in nursing homes, or extended care facilities. long-term goals are completed over a long period, usually over weeks or months. For example, patients will participate in activities that reduce cardiac workload. Goals or desired outcome statements usually have the four components: a subject, a verb, conditions or modifiers, and the criterion of desired performance. Subject. The subject is the patient, any part of the patient, or some attribute of the patient, such as patient's pulse, temperature, or urinary output. The verb specifies an action the patient is to perform. For example, what the patient is to do, learn, or experience. Condition or modifiers. They are the what, when, where, or how that are added to the verb to explain the circumstances under which the behavior is to be performed. Criterion of desired performance. The criterion indicates the standard by which a performance is evaluated or the level at which the client will perform the specified behavior. These are optional. Okay, please look at this goal statement. Can you tell me which is subject, which is the verb, which is the conditions or modifiers, and which is criterion of desired performance? Yes, patient is the subject. The verb is administers. The condition is correct insulin dose. The criterion is using right aseptic technique. Now, let's get to know the nursing intervention. Nursing interventions are activities or actions that a nurse performs to achieve client goals. They are performed during the implementation step. Types of nursing interventions are independent, dependent, and collaborative nursing interventions. Independent nursing interventions are activities that nurses are licensed to initiate based on their sound judgment and skills, including ongoing assessment, emotional support, providing comfort, teaching physical care, and making reference to other healthcare professionals. Dependent nursing interventions are activities carried out under the physician's orders or supervision, including orders to direct the nurse to provide medications, diagnostic tests, assist medical treatments, and etc. Collaborative interventions are actions that the nurse carries out in collaboration with other healthcare team members, such as physicians, social workers, physical therapists. These actions are developed in consultation with other healthcare professionals to gain their professional viewpoints. Nursing interventions should be safe and appropriate for the patient's age, health, and condition. Achievable with the resources and time available. Congruent with the patient's values, culture, and beliefs. Congruent with other therapists. Based on nursing knowledge and experience or knowledge from relevant science. Within established standards of care as determined by laws, professional organizations, accrediting organizations, and the policies of the institution. A nursing care plan should provide rationales that are known as scientific explanation. Also are the underlying reasons for which the nursing interventions was chosen for the nursing care plan. rationales do not appear in regular care plans. Rather, they are included to assist nursing students in associating the pathophysiological and psychological principles with the selected nursing intervention. Nurses must write nursing care plan correctly. Nursing care plan formats are usually categorized or organized into 4 columns. First, nursing diagnosis. Second, desired outcomes and goals. Third, nursing interventions. And fourth, evaluation. Student care plans are longer and have more details than those care plans used by nurses in practice because they are learning activities for the students. These slides show the example of care plan format and a sample of student care plan. I hope they can help you to understand the content of this session. Thank you for your attention. See you next time.